Righty. Well, hello and good evening, everyone, and thank you so much for joining our very next Health Equity Team COVID-19 Town Hall Series. This particular event is going to be really special because we're going to tap into something that is really unfamiliar for a lot of us, which is dealing with long haul COVID. So we've had a number of different questions that have come in throughout the entire time we've done this town hall regarding vaccinations and wondering about some of the side effects and things that comes with that, right? But where we really haven't explored are some of the actual long-term symptoms that can come from actually contracting COVID. And so this is where we wanted to tap into that specifically during this town hall so that we can get some of our experts and those who are on the front line dealing with this every single day to provide you some of the most up-to-date information related to this. So without further ado, I'll go ahead and introduce our lovely panelists. So first we have Miss Melissa Lynch. She is a representative of the International Charity for Children and Families who support long COVID kids. She is also a native of North Carolina, a certified medical assistant and registered medical assistant with over 26 years of clinical experience, as well as being a former lead in clinical lab, as well as OSHA compliance within multiple specialties. She is a true pediatric advocate within the United States, assisting not only with international organizations, but at the state, federal, and community levels to give a voice to all children with post-viral conditions, as well as their families. Melissa has 4 children of her own. Her youngest daughter has post-acute COVID syndrome and is the main motivation behind why Melissa's passion is to see change within not only the education system, our research and healthcare communities to find answers, but to also ensure policies, accommodations, resources, and support is available. She is also a CCCP champion and national COVID hero. And she has also assisted to ensure children with PASC have accommodations covered under the ADA and the IDEA in school. Everyone, please help me in welcoming Miss Melissa Lynch to our panel. Thank you so much, Melissa, for joining us. All right, next, we have Dr. John Barrata. He is a physician who is board certified in physical medicine and rehabilitation. He graduated from medical school at Wake Forest University and completed his residency training at the University of North Carolina, Chapel Hill, go Tar Heels, where he also served as the chief resident. He is on the faculty as an assistant professor at the UNC School of Medicine. And Dr. Barrata founded and co-directs the UNC COVID Recovery Clinic, which helps to address the medical needs of COVID long haulers. So again, another expert into the field. Everyone help me in welcoming Dr. John Barrata to our panel.
Thank you.
Awesome. So thank you both so much for joining me. Again, like I mentioned offline before we started, I am really excited about this particular town hall because I am really ready to learn a lot about COVID long haulers. Again, I know that there's a lot of information out regarding some of the different symptoms you may experience, even if they're mild of receiving a vaccine, right? And there's a lot of controversy and divisiveness around actually getting the COVID-19 vaccine. But I think one of the things that we should also keep in mind is that if we're looking to maybe be a little hesitant when it comes down to actually getting the COVID-19 vaccination, we want to make sure that you're aware of all the risks that are associated with that. And again, this is why we're wanting to talk about this particular subject here this evening. So before we kind of get into the questions, Melissa, since you specifically have someone within your own family, a loved one, who is experiencing this actual scenario of being a COVID long hauler, could you give us a little bit of background about your daughter and everything she's experiencing? You're on mute, Melissa, I'm sorry.
My camera keeps going out, so I apologize. She contracted COVID originally September 4th. And back in 2020, I'm just going to turn my camera off because it keeps on wanting to do something weird. There we go. But can you still hear me, Krystle? Okay. She
Yes.
contracted COVID September 4th of 2020, and she continued with a mild acute infection and was released to back to normal activities. Can you go ahead and skip me and let me sign off and sign back on? Because for some reason this thing is just not wanting to happen.
Yeah, sure. No problem. No problem at all. We can definitely do that. We could take a little pause for a second.
Okay, I'll be right there.
Well, in the meantime, while we're waiting for Melissa to sign back on and kind of get the technical difficulties together, Dr. Baratta, could you maybe speak to a little bit of a background of what you see every day, and then we can actually tap in and speak more, I guess, a little bit more fluently about specifics when we get into the questions. So.
Absolutely. And what would a Zoom call be without some technical difficulties? We've all gotten used to this over the last couple of years. So,
Right.
So right on time for that. This time it wasn't me though. Yes, I am I founded and I co-direct the UNC COVID Recovery Clinic, which is a program that has been designed at UNC to help manage the lingering symptoms and health effects of people who have long COVID. So one of the natural first questions is what is long COVID? We hear about it a lot in the news, terms like long hauler, long COVID. And so let me just start off by briefly explaining that. Long COVID is a syndrome characterized by lingering health effects or ongoing symptoms after resolution of the initial infection. So for a normal viral illness, it should be a period of a couple of weeks, usually not more than 4 weeks, that we are affected. So you could think of a cold or the flu for most people. Typically, those are viral illnesses, and typically they are self-limiting, which means that they don't have a whole lot of other effects throughout the body. They kind of stay in maybe the respiratory system or the lungs, and then they typically resolve, they go away. What's different about COVID is that for a substantial percentage of people, there are lingering effects. And while this is all very new, and we admittedly don't have a lot of data, what we are seeing from the most recent updates from really throughout the US and throughout the world is that up to 10 to 30% of COVID-19 survivors do experience some form of lingering health issues or symptoms. And that can last for weeks, for months, or perhaps even longer. We have some patients in the clinic who had COVID more than a year ago and still have lingering effects, which we attribute to COVID. The symptoms can be quite variable. So just like the initial COVID illness, for different people, it affects them in greatly different ways. And long COVID similarly affects people in very different ways. Some might have more prominent fatigue or difficulty with breathing. Some have more challenges with concentrating and memory. Persistent loss of smell and taste is a common one. And there are a whole variety of other issues, which I'd be happy to get into in the hour if that's of interest. But needless to say, it's a challenging syndrome to treat. One, because it's so new, and two, because it's really variable in how it presents in different people.
Wow. Yeah, I mean, yeah, just hearing that, I'm really excited to hear a little bit more now, especially because, wow, you've had someone in your clinic for months on, it's not even a day or week type thing. It could be as long as months being treated in your clinic. That's pretty alarming. But yeah, well, what we'll do, Melissa, are you there? I see you're back. Is everything good? You're on mute. Oh, wait, you're still on mute. I can't see you. Oh, there we go.
It's doing better, thank you. Now, what question did you have?
No, you're fine. I just wanted you to kind of give a brief overview of kind of your daughter's experience, and then we were going to lead into the questions.
Okay. She contracted COVID September 4th of 2020. It was confirmed because they didn't have rapids back then on September 17th. Of course, we did the protocol of, 5-day wait, and then it took about 4 days to come back for PCR. She was put in a virtual hospital as a precaution back then, just because it was brand new for children. And she was released to normal activity on September 28th. And September 29th, she was fine. She had a very mild and, acute infection, no cough, no fever, no runny nose, nothing. But September 30th, I went to go wake her up, and it was like Weekend at Bernie's. She had severe lethargy. She had lost her sense of smell again. Still no fever, no cough. Her oxygen levels had not dropped. It was mostly fatigue between October and December. They thought they had found heart damage on a cardiological test from COVID in December. And then she was released to return to normal activity again in January. That lasted for 2 weeks. And it sent her into the bed on January 23rd with 103.2 fever for 3 days, could not get out. And we have had 23 waves since January 23rd of this year. We have something different every time. We've had everything from a fever of 102 lasting a month. She is now experiencing cognitive loss, memory loss, what they call brain fog, cognitive learning loss. She exhibits cognitive malaise, also exertional malaise. And those are where you get tired, from just really using your brain and physical activity. She has seizures, and she's beginning not to feel her legs. It's getting harder to wake her up. Her blood pressure, I cannot stabilize right now at this moment. This relapse has been going on since September 17th of this year. And her blood pressure has been hanging out anywhere between 74, 82 on top to 57. And then today it was 52 on the bottom. She has tachycardia, where her heart races when resting. It'll jump from 60 some beats per minute to 130. I think it's been the highest. Syncope. Her teachers have explained that her eyes cloud over, and she glitches like a computer, just doing every normal day tasks, and even in the middle of sentences. She has gone from a 9th grade level and coming out of 5th grade. She's gone from a 9th grade level English and a 7th grade level math. We are now down to 3rd grade level English and 1st grade level math.
Wow. Oh my goodness. I am so sorry to even hear all of this is going on with your daughter. I couldn't even imagine as a parent having to endure this for over a year at this point. And you said it was how many different, you said it was spells? I'm sorry, what was the word you mentioned?
I kind of describe it like lupus. It comes and goes in waves. The symptoms may differ and vary from patient to patient, but it still comes and goes in waves, and also relapses. It may vary. Symptoms may be mild or they may be extreme. We have some children within our group that even lost mobility. We have some that's lost sight. But this one, like I said, has not let up, and you never know when it's going to hit. I used to be so organized. Now I feel like, everything is just like drop the moment, never get anything done, because there's always something happening, especially with this last relapse lasting a month.
Yeah. Oh my goodness. Yeah, I couldn't even imagine. Could you do me a favor too, before we actually dive in again to the questions, and kind of give the audience a little bit of background about Long Covet Kids and your organization and what you guys are doing?
Yes. We're an international charity that does support for families of long COVID children. We have a private group on Facebook, and you have to either have a positive tested child. We are accepting, because of the pediatric surge, we've been there as parents. So we're reaching out to support those families that have newly tested positive children. We also have mostly support long COVID. We have a gallery of symptoms. We are also collaborating with several government and professional organizations, and helping give a patient voice for these children, and guidelines, and exactly so they'll know what's working and what's not. But we are 8 countries spanning, and let's see, America and Facebook, the private group alone, supports close to 600 families alone. We are across all social media, and all together globally, we are supporting 18 to 20,000 families.
Wow, that's a lot. Kudos to the both of you for all the work that you're currently doing, Dr. Baratta with his clinic, and with you doing, again, having that patient voice, so that individuals who are trying to get the science and the information out there, they're also hearing directly from the community, hey, this is what's working, this is what's not working. So great. Thank you so much to the both of you for that background and just a little bit more information. So we'll go ahead and get into some of the questions. A few of them Dr. Baratta did kind of tap into. So, but if you could, let's go ahead and give like a formal definition of what long COVID is. So Dr. Baratta, could you give us again what that would be defined as?
Yeah, sure. And again, I'm so glad that Melissa is on and helped to arrange this. I think it's so important, the advocacy work that her organization and other patient-led organizations are doing. This is a new syndrome that we don't have a whole lot of information on, because it's all been so recent, and the awareness that these kinds of organizations are drawing to it is really phenomenal and very, very helpful. So to back up to your question, Krystle, what is the definition of long COVID? So you could consider long COVID to be a syndrome characterized by persisting symptoms or health effects after resolution of the initial COVID-19 illness. And this is something that can persist for weeks, for months, or even longer. And it can be associated with a whole variety of symptoms or health effects, some of which Melissa has mentioned in her daughter. Some of the most common ones that we see in our clinic include fatigue, shortness of breath, and respiratory discomfort, which is like difficulty breathing or pain with breathing, brain fog, headaches, pain, loss of mobility, and a whole variety of other issues. This syndrome is unique because and challenging because it can affect a variety of different parts of the body and also the mind, affecting cognition and also emotional well-being. So that makes it challenging to assess and treat.
Wow, yes, I definitely could imagine. Yeah, because just even hearing the list of symptoms that Melissa said her daughter had, it was just alarming to know just that precious life is dealing with all of that at once, or maybe like she said in waves, but either way, it's just kind of disheartening. But wow, very interesting. One of the other questions that came in is there a particular age group who may be more impacted by long COVID, children versus adults? I feel like Dr. Barata, you did kind of touch on that, but either one of you could answer.
Yeah, I'm glad to mention that I don't think that there's a specific age group that is most affected. I think any age of person who gets a COVID infection can be affected with long COVID. Our clinic, the UNC COVID Recovery Clinic, is primarily focused on the care of adults, although we see a handful of pediatric patients under 18. So we see the gamut from we have seen from early teenage years up to beyond 80 in age. However, most of our patients in our population range between 40s to 60s, but that could just be our population too. I think that the bottom line is anyone at risk for COVID infection or COVID illness has the possibility of getting long COVID.
I can go ahead and chime in on the children's risks. According to the clock study that was released in BMJ just recently, about 3 weeks ago to a month ago, 1 in 7 children that are even asymptomatic but that do test positive are at risk for long COVID. 14% of that will continue on past 15 weeks. 80% of that percentage will be female. And also between 12 to 16 is the highest rate of risk for long COVID in children 0 to 17. And also in America, they are the lowest percentage vaccinated.
I want to underscore something that Melissa said, which I think is so important. Long COVID can affect anyone who tests positive. And this, I think a lot of people might have the misunderstanding that long COVID might only affect people who had a really severe COVID illness, maybe who needed to go into the hospital or be in the ICU. And that is not the case at all. The majority of people that we actually see in our clinic had a more mild illness. They never needed to go into the hospital, yet they have these persisting effects. So I think that is a really surprising thing. It's definitely not what I was expecting when we started the clinic. It was to have so many people who had a more mild initial illness have lingering symptoms.
I am so glad that you brought that up, because with Melissa saying 1 in 7, with some of, the pediatric numbers, and again, the assumption a lot of times with, most of the, people in the community, they're thinking, well, children, they're not old, they're not older adults. They don't have a lot of pre-existing conditions. They're fine. They're good. They don't have to worry about COVID as much, right? So the thought process is that their immune systems are strong enough and they'll be able to move past this. But in just hearing what you guys are saying, it's pretty shocking to just know that, again, with them being the highest as far as having those asymptomatic scenarios and not having anything at all, or maybe mild symptoms, being 1 in 7 was kind of, alarming, to say the least.
And a lot of our children within our group, they had no comorbidities at all before. It doesn't, it affects both female and male with a variety of symptoms.
Wow. Thank you for that. All right. So the next question we just got in is long COVID a result of immune systems that are technically turning off and are creating autoimmune conditions? This is something that just came in from our community. And either one of you guys can speak to that.
I'm glad to
Let Dr.
start.
Baratta handle that, and then I'll
Sure.
comment.
I think if anyone told you with certainty that they knew what was causing long COVID, I would question them, because I don't think we have a clear understanding. There are theories, but there's nothing that's been proven with certainty. So I'll talk with you about some of the theories as far as reasons for long COVID, for these lingering symptoms. And one is that autoimmune theory, where basically there might be an autoimmune phenomenon in the body, which is when the body actually produces cells that attacks its own organs. Might be organs in the body, or even perhaps the brain, and causes misfunctioning or dysfunction of those organs. So that is one possible scenario. And I think there's real, I think there is real possibility that could be the case for many patients. There's also the possibility that it might be more of an inflammatory issue. Many of you may have heard that there is an inflammatory cascade. There are all these chemicals that get released during COVID illness, and that could cause improper functioning throughout different parts of the body. So autoimmune is one possibility. This inflammatory issue is another. An additional possibility is that there could be persisting fragments of the virus that kind of irritate the body. They don't get totally cleared out during the initial body's immune response, and so they kind of stick in there. So I think that's a great question. It's definitely the area of current research, and hopefully we'll know more as time goes on. But those are probably the top three suggested reasons for long COVID. And I want to say that I think it may be a combination of all three of those, or perhaps other factors too. I think the cases that people experience are so variable that there may be multiple processes going on, and that complicates it even further.
Definitely. Were you going to say something too, Melissa?
Yes, I was going to say that within our group, we are seeing a lot of children coming out with what they call the silent disorders. A lot of them are having pandas, POTS, dysautonomia, ME/CFS. A lot of this is being triggered. It's a multi-system. The way that her cardiologist, that Wednesday's cardiologist, I think he put it the best, is your systems are not talking to themselves or communicating within your body. They're being a jerk to each other. So they're not communicating at all, and they're combating and misfiring, which causes a lot of the symptoms. But it like I said, they're discovering microclotting. They're discovering inflammation. I just got a notification where the lining of the vessels are inflamed along with the microclotting. So we're still all learning, and I being medical understand that process. But we're trying as much as we can. We worked with the NIH. There are studies out there, research out there. There's several researches going on here in North Carolina now. There's a lot of researches and resources, online that you can find across the country. We take Wednesday back and forth to Children's National. We also go to UNC. We've been to Duke, and we go to Levine. So, and we know some parents that travel 4 and 5 states across just to go to a specific, to get specific care.
Wow, which I couldn't even imagine some of those individuals who don't even have the ability to actually seek care 4 or 5 states away, how much more of an inequity they're encountering. I couldn't even imagine. So All right, so our next question is there a current treatment available for those suffering from long COVID? So I know that there's seems like a microcosm of different symptoms that you guys have listed, right? But is there any specific treatment that, or, you know, some type of way in your clinic, even Dr. Baratta, that you have seen has worked the most with anyone dealing with long COVID?
Yeah, so because, as I just mentioned, we don't have a clear understanding of the underlying medical reason for long COVID, I think that makes it harder to treat because we don't have like a special medicine or other approach that could just target the issue that's going on. So really what we found to be most effective is to closely and carefully evaluate the patients like across a number of possible symptoms. And after we've determined what symptoms or health issues are most significant, we come up with a treatment approach tailored to that. The treatments may include things like exercise programs or therapies. They may include medicines or other approaches. We do also use further workup like lab testing and imaging studies to make sure that there's not a more standard medical cause going on for a person's symptoms. But really it just depends on what their most prominent symptoms are. So I'll give you an example, maybe of fatigue, which is our most common symptom that we hear people mentioning. We'll do a thorough medical evaluation to look for other causes of fatigue, such as low blood counts, heart or lung problems, and other things like that. Assuming that the medical evaluation checks out okay, and we don't see other underlying medical causes for the fatigue, we would feel comfortable usually starting the patients, the long COVID sufferers, in an exercise program to help gradually build up endurance if they can tolerate it. Some people can't tolerate it, and Melissa had mentioned a syndrome called post-exertional malaise before, which is a whole different kind of syndrome that needs to get approached and managed in a different way. So there are a lot of complexities to this, but building up with exercise can be useful. We also may use medicines to give more energy to help stimulate a person's brain or activity tolerance. So these are some of the approaches that we might use for fatigue as one example. And as we've mentioned, there are dozens of possible symptoms and health issues. So we just approach it like that.
Awesome. Thank you so much. What are some treatments, Melissa, that your daughter has encountered thus far?
Well, because of this last relapse, I'm going to be honest, they stripped her of all medications. The only thing that was wrong with her before, honestly, was ADHD. She was on Vyvanse for that. And, you know, when she caught COVID, the acute, they stripped her of all of her medications in order to not conflict with any symptoms arising. But she has, as of today or yesterday is when she saw her cardiologist. We cannot get her blood pressure stabilized right now at this moment. And so she's being put on a prescription after trying an over-the-counter homeopathic recommendation for 2 weeks. If that doesn't stabilize it, then we're going to have to actually go to the prescription to, you know, stabilize her blood pressure, because she is becoming, like I said, extremely harder to wake. Instead of sticking my head in, and it normally took me an hour with the extreme fatigue, it takes me about 2 hours now to get her up. And I have to go in and physically shake her. She can't, like I said, she can't feel her legs at the time. And today we tried the vagal response to counteract a vagal response. We tried, how you would tell a pregnant or, maternity patient to keep crackers in water or something by the bed and, munch just a little bit before you get up so you won't get lightheaded. We tried that with her today, and she bottomed out. She bottomed out yesterday. She's passed out in the car now. And like I said, it's very disheartening, but that's really the only thing right now that we're on. And Dr. Baratta is going to help me with that. I am so grateful for him because she was diagnosed October 1st of 2020 and nobody knew anything about it. And the closest pediatric was Oklahoma City. It's made a world of difference. And it really has. These children come out crying from these post-COVID care units because most of these children are told that it's psychological. Now, some of it, can be because it triggers depression and makes PANS is a neuropsychological, disorder because of the inflammation. But they come out crying and they think, but a lot of these children, 50 to 75% of long COVID children miss school because they can't make it through the day.
Wow.
I appreciate your kind words, Melissa, and it's my pleasure to care for you on Wednesday. I agree. Think about, if you, if you could imagine being previously healthy, very active and functional. Wednesday, I think, did a lot of cheerleading, and for adults, going to work, having family and friends that you might spend time with, and then to have that all pulled away right away, suddenly, and be thrown into essentially a chronic illness with many times vague symptoms, with poor understanding of your disability, because for many people it's not visible, and having to deal with that sudden change. I think that would make anyone really, really sad, and can definitely affect mental health and mental well-being, causing depression and anxiety and PTSD. And we see that a lot in our clinic. It's not the cause of long COVID, but it is certainly an effect of being thrown into a new chronic illness all of a sudden.
Wow. Absolutely. And to your strength, Melissa, just for, your own mental wellness and dealing with this. This could be a lot, on you. I could imagine parents who are encountering this, it's heavy.
Well, a lot of our children within the group, their parents are also long COVID. So you can imagine the compounding part. This is my second pandemic. I immediately went into pandemic protocol in my house whenever she was exposed. And I found out my whole family thought I was nuts. But seriously, you got to think it's a multifaceted problem. The parents can't work because, maybe their symptoms are extreme. That's how long COVID kids were found. We're all medical and we're all parents of long COVID children. And I think only me and one other over another country has no long COVID. I have yet, and knock on wood somewhere, but
Yeah, that is, oh my goodness. Wow. All right. Well, let's get to the, thank you so much. I'm sorry for for both of those responses. I'm kind of all tuned into what you guys are saying. I knew this was going to happen. It's just so intriguing. So the next question we received is, speaking of pandemics and going through different, pandemics in the past, what is so different about COVID versus other pandemics we faced in the past? So either one of you could, or Dr. Baratta or Melissa, you could speak to that.
The transmission rate is for one, especially with the mutations. The Delta, for example, is 1,000 times transmission viral load than the original strains. You can keep up with the variants on who they actually have a variant page, variants of interest. But for example, the Delta can be transmitted even with vaccination, and there is, studies proving that the viral load between someone that's vaccinated and unvaccinated is the same. And correct me if I'm wrong, Dr. Baratta, but also, with that being said, say half of your family is unvaccinated, the other half is not, or is vaccinated. They may bring it and give it in because, you're always, I have to watch for Wednesday because she's at risk for breakthrough viral infection, because she's been vaccinated. So she's at risk. They didn't want me to bring her to the ED the other day because one, of the transmission. They were concerned of the COVID transmission within the waiting area. So I had to monitor and, I worked with her doctors before, so they know, but I had to monitor her every 2 hours, all of her vitals.
Wow. Dr. Baratta, would you like to speak to?
Yeah, I think Melissa's absolutely right. The transmission rate is a big factor here. So COVID is caused by a virus named SARS-CoV-2. Sorry for the medical jargon. But there was a SARS-CoV-1, which predated that. That was the SARS outbreak in the early 2000s. It wasn't nearly as contagious or transmissible. People who got SARS did have some lingering effects, but it wasn't as apparent or as much of an issue because far fewer people got the initial illness than SARS-CoV-2, which causes COVID-19. So I think that's a big factor, is that just the sheer volume of people who have gotten COVID-19 and who are at risk for these lingering effects. There are clearly a lot of things about this virus that we in the medical community don't fully understand. So if I can just take a moment to say really the best way to avoid getting long COVID is to avoid getting COVID. And the best way to avoid getting COVID is to get vaccinated. The vaccines are safe and effective. For anyone who is still on the fence, I would really encourage you to consider doing it because it can greatly reduce the risk of getting sick, particularly severely sick with COVID, and certainly also greatly reduce the risk of long COVID. In our COVID recovery clinic at UNC, we've seen over 600 people with long COVID, and over 99% of people were unvaccinated when they had the COVID-19 infection. Okay, so that is a small amount of evidence to suggest that being vaccinated can reduce the risk of getting long COVID.
Thank you so much for that. Oh, I'm sorry, Melissa, were you going to add to it too?
I was going to say that's one of the main reasons, not I mean, it goes into the variant. It has something to do with the variant too and the mutation. But that's one of the main reasons that you're seeing the increase in pediatric, because, you know, you don't have vaccinations out yet. They're coming out though, for 5 to 11 or 11 and under. And like Dr. Barata said, the best way to prevent long COVID is to prevent COVID. The vaccination does not ensure 100% that you are going to not get it. It will be milder. It's just kind of like, you know, say the flu shot, you know, but it is, I mean, with mitigations and the vaccination, it comes into play altogether. It's just basic pandemic protocol. If you're medical, you know what that means.
Gotcha. All right.
And my daughter is 2.5 years old. She is not eligible for vaccination yet, but I can assure you, as soon as she is eligible for a vaccine, I will take her. I really believe in the safety and efficacy of these vaccines. I've gotten my 2 shots and the booster. I really believe that they're very helpful.
I'm with you on that one as well. I agree. All right. So speaking of being vaccinated, this was another question that came up. If a vaccinated individual is diagnosed with a breakthrough case, just like Melissa just said she's concerned about with Wednesday, is there still a possibility that they may experience long COVID? And I'm assuming that would be the case, since you said in order to avoid long COVID, you have to avoid COVID. So I guess if you wanted to expound a little bit more on that, you can. I feel like you did kind of already answer it, but was there anything you wanted, either one of you guys wanted to add to that?
Everybody's at risk of getting long COVID if you have COVID. It doesn't matter. It does not discriminate across the board, does not discriminate, just like COVID doesn't discriminate. It doesn't care what age, race, religion, political, anything. It's, you get it, you get it. And you're at risk for long COVID. That's it.
Right, right. And I think, again, speaking to the fact of what you guys reiterated was, you know, of course, getting vaccinated will help to lower at least your risk. It's not 100%. We all know that, but that's with any vaccination, by the way. Nothing's 100%. But it will lower your risk, and then, of course, not have such a severe outcome as well. So we do know that that is a good safeguard. And to your point, Melissa, as well, we do know that vaccinations for our younger population, they're looking into all of that science now to go ahead and release soon. And so we know that that's at least going to be a safeguard that we'll have available.
Yes, we partner with CDC, FDA, and all that. So I'm in all those meetings, and yes, I know it's being released. And I think I'm hoping that 5 and under will come out. I think they're estimating right now by next summer, but I'm not positive. Don't hold me to that.
Gotcha. All right. Well, the very last question that we have is one related to our upcoming holiday, where we know all of the kiddies are going to be enjoying all of the fall festivals and Halloween. So the question reads, with Halloween quickly approaching, what advice would you provide to parents as it relates to long COVID and safety protocols? So you both can speak to this. I know, Dr. Baratta, you work mainly with, you know, adults and everything like that, but of course you have that wealth of knowledge when it comes to this. And you know, again, with some of the surge in numbers with COVID within our county and neighboring counties, I know that this was part of the concern and why this was brought up, because we know that there are a lot of different either faith-based communities that are planning to do a Halloween-based event, or schools, or even daycares, or anywhere where children might reside. We know that there has been, you know, talk of having these type of celebrations. So what are some of the just, you know, typical safety protocols that you would recommend?
I'd be glad to speak to this. And Krystle, adults can get dressed up too for Halloween. It's
That
not
is true.
just the
You're right.
little ones. So I think Halloween can be a holiday that can potentially be enjoyed safely, even in a pandemic, taking particular precautions. The question reads about long COVID, but I'm really going to talk about the acute COVID illness because that's really what's transmissible. I do want to clarify that people with long COVID can't transmit COVID if they're outside of that initial infection window. Okay, so someone who has long COVID for months or even a year isn't at risk for transmitting it because they don't have the active COVID illness. So I think when it comes to this particular holiday, it actually lends itself to being a little bit safer than other holidays because a lot of it is spent outside for many people, which we know is associated with a lower risk of transmission. I'd suggest in order to do it most safely that people stick in groups of their household members probably, or their close circle for trick-or-treating. Probably don't go with large groups of other households. The kids will likely get close to each other and would be at risk for spreading illness. I think it would be good to consider the types of costumes that you choose. So if your kids particularly are going to be with others outside of your household, pick a costume that lends itself to using a mask as well, and maybe doesn't include a full face covering where a mask wouldn't be doable. I think that it would be good to probably provide some separation in between trick-or-treater groups. So if someone's at a doorstep of a house, you may not want to crowd them, stand back a little bit until they pass. And I think for passing out candy, it would be a great idea to perhaps set up a table a little distance from where you would be standing or sitting, and perhaps even package the candies in little individual plastic bags or baggies so that people aren't dipping their hands into the bowl over and over, that others will as well. So those are some general ideas, but I think Halloween can still likely be enjoyed safely, and I hope you all have a happy and enjoyable Halloween.
Thank you for that. I agree. I do think that there's ways that we can definitely make this a safe event. And you're right, adults can and celebrate as well. So I'm assuming some of the same protocols and tips will be provided to adults, making sure that you're masking, you're social distancing, you're not crowding if you're deciding to go celebrate on Halloween. So I do agree with that. All right, well, we are winding down to the end of our town hall. I want to thank the both of you for being such awesome panelists. You've been able to provide me with so much information. I mean, to the point where I kind of got lost in the conversation and forgot I was hosting. So thank you so much for making this super easy. One thing I did want to point out is that Melissa did let us know that she recently provided some literature to healthychildren.org. It's speaking to the long haul COVID in children and teens. I advise everyone in the community, if you get a chance, to go on to that website and look over, just her experience of speaking about her daughter. And then it just, of course, reiterates some of the same tips and information that we provided here today. Is there any additional information you wanted to provide to the community, Dr. Baratta or Melissa, so they'll know, to whether it's socials or just information about your clinic or anything like that?
You can find us at longcovidkids.org. We're on, like I said, we're on Twitter. I am at LCKUSA, and I'm also have my own that kind of follows, because Wednesday's story a little bit better with the media, and that's at Mom of Long COV Kid. And at the longcovidkids.org, we have everything from informational school packets to, like I said, symptom galleries. And we're across all social media. So if you just want to follow us on Twitter for a little bit and make sure, yeah, because we share research that we're collaborating with. We also share, you know, what's new and what's out. But also, like I said, I've been going through this for a month. So my page right now is kind of slow because we all volunteer for this. And but yeah, come and follow us, and you can contact any of us. And we also have a weekly newsletter too, if you'd like to sign up.
Awesome. Thank you. Dr. Baratta?
Yeah, I think I would encourage you all to look up Wednesday Lynch's story. I think it's really compelling. And there's some great media videos about it and other information. I personally don't have a Twitter handle. I'm not cool enough for that, so they don't let me. But that's okay, because we do have a website. And so if you just Google UNC COVID Recovery Clinic, that has information about our eligibility criteria and what services we offer, that would be the best way to get in touch with us, Googling UNC COVID Recovery Clinic. Thank you for the opportunity to be here and share this information.
Absolutely, because one thing that I think, again, that we talked about early on is that we have so many families that really do need these type of services locally within our state, and that they can actually access, you know. So being able to have someone that is a part of our North Carolina network that is able to provide these type of services is just key, you know, at this point. Because speaking to Melissa's point before, I've known of parents with other scenarios with their children or even themselves, and where they've had to go across the state, throughout the country to find services. But to know that we have someone that is doing the work right here in North Carolina is just key. So I wanted to make sure everyone had that information. So again, community, you have everything you need to be able to at least provide this information to others. So please share this. Don't keep it to yourselves. Dr. Baratta and Melissa, again, thank you so much for joining us, and I will see you. Oh, I'm sorry. Oh, go ahead. I'm sorry.
I said, thank you, Krystle. Thank you, Adam.
No problem. And we'll see you guys later. Thank you so much. Have a good night.